Seshni Valma. Can we continue the conversation regarding mental health?
Yes, Valma. Good morning, and thank you for having me on your show.
I'm sorry about that. I really don't know what happened. I've been doing a bit of research around, brain fog, but also I sort of looked at all the areas within mental health that is covered in terms of anxiety, attention deficit, hyperactivity disorder, autism, bipolar disorder, borderline personality depression, eating disorder, OCD, post-traumatic stress, schizophrenia, cognitive decline, which is brain fog, and that's what we want to talk about today, and also suicide. One of the things I'm thinking, with COVID that's happened and it's impacted on the health of the population, particularly mental health, do you think that there's going to be a new diagnosis within the category of mental health in terms of the outcome from the COVID?
That's an interesting question, Valma, but as you can understand, with COVID, there's a number of psychological impact and disorders related to long COVID, and as you mentioned, brain fog. So there is some significant sequelae, psychiatric sequelae, as a result of long COVID. And if I can touch a bit on each of them and then explain a bit more, that will give us more insight as to the weight that might carry in future and as to whether this will be something separate in the future. But at the moment, the way things are looking in terms of COVID, as you know, when someone gets COVID, it usually lasts for a few days to at least 2 or 3 weeks. If it goes on longer than 12 weeks, if people have symptoms, then we consider it long COVID. So, and as a result of that, brain fog is one of those conditions. You get depression and anxiety.
Yeah, because I've been on the Department of Health website and it says 12 weeks.
Yes.
After 12 weeks, that if one still suffers from some signs and symptoms, and that itself could have an impact on somebody's well-being. I mean, some of the things they talked about was depression, anxiety, memory, managing fears and anxiety. I mean, I've come across a few individuals who, one, because of COVID, they no longer want to socialise. It's as if over the 2 years, some of the people have got into this habit of not wanting to go out because of the fear associated with COVID in the past. And still now, some people are still very scared and still have anxiety in terms of mixing and socialise with individuals. And so how can we encourage individuals to look at their anxiety and try and help them to realise that life must go on?
Yes, exactly. I mean, Valma, that's a really good question. And people are living with COVID. As you know, 2 years down the line, we're all living with COVID. But there's still that fear and anxiety, such as coronaphobia and chronophobia, the fear of getting COVID. And rightly so, people are still isolating themselves and developing what we might call social isolation or social phobia. So there's a lot of consequences as a result of COVID, long COVID, and brain fog. I think in terms of dealing with the fear, I think what we need to realize is that we've gone through the COVID pandemic, and we are still in a sense in the COVID pandemic. And what we've done during the COVID pandemic is keep ourselves safe. So we've had lots of advice from the World Health Organizations, and we've been able to keep ourselves with wearing a mask, hand sanitizing, maintaining distance, and washing our hands. So and as a result, after that, we've also, lots of us have been vaccinated. So I think when people are faced with that fear and anxiety of getting COVID, it's a real anxiety. So I think the first thing is to accept that there is this anxiety and fear around getting COVID. So it's real. And I think, Valma, you've been in the situation, I'm sure, as I've been, and so many other people that are listening, where we all are still living with that somehow behind, in the back of our mind. We're still thinking that we might get COVID. And that's a reality.
Yeah, but the other thing, I'm sorry for interrupting you there, but the other thing is I'm thinking about self-healing, because, you go through this sort of health problem, and then you come out. But it's also about self-healing, isn't it? Because to me, it's, you sort of have to look after that COVID episode, because when you isolate yourself, yes, psychologically it has an impact on you. It has a physical impact on your body, and then you have to, when you come out of that, it's all about self-healing. How do you heal yourself after that? What I classify as a bit of a traumatic phase, because there's so many different areas, socialization, the physical aspect in terms of the fever, the cough, isolation in terms of with the family members. Then there's the bereavement of people that you've loved have passed away. It's like a circle of events that you've got to self-heal.
Yes, that's correct.
What's your perspective on that?
Yes, that's correct, Valma. And if we look at when someone gets COVID and after they've had COVID, as you said, it's about self-healing. And if it goes on for longer than 12 weeks, then they have what we term long COVID. So long COVID can be symptoms, physical health symptoms, such as shortness of breath, palpitations, ongoing coughing, weakness, fatigue, exhaustion, and then the psychological symptoms of and palpitations. Other people that might have psychological impact of long COVID is, I think what you're talking about, is that they can have a depressed mood, they can have depression, anxiety, they can also have the symptoms of isolation and social phobia, they can have PTSD, they could also be dealing with the aftermath of grief if they've lost someone through COVID and whilst they've had COVID. And there's also the brain fog and the memory difficulties. So as you know, I think it would be a holistic approach to manage. I think the main things is it's about, as you said, self-healing. So taking care of yourself, getting help if you need to, getting support from friends and family, and checking in with them as to what symptoms you may have. On the NHS website and on the government website, there's enough information and resources. There is also a recovery from COVID website where you can get help and support.
Yeah.
Yes.
I've got that for the listeners. In fact, it's www.yourcovidrecovery.nhs.uk if anyone wants to look up further information regarding what we're talking about today, in terms of the after effects of COVID on individuals and mental health.
Exactly. So in terms of long COVID, if you have any physical health or mental health symptoms, do seek advice from a GP, a healthcare professional, speaking to family and friends and colleagues and getting support. I think what you need to realize, if you've gone through COVID, people don't recover immediately. And what we are seeing is more and more people are extremely exhausted, tiredness, they have difficulty breathing, and then it impacts on their, because their energy levels are low, it does impact on their mood, motivation. They can get depressed and they can have memory problems. So I just want to touch on the memory problems or the brain fog, if that's okay with you.
Yeah, yeah. Let's go into that. That'd be excellent.
Yeah. So thank you, Valma. So brain fog, I think this is why you wanted me to talk today. It is becoming a reality. So lots of people are experiencing difficulty in concentration and attention and some memory problems. So usually the memory problems with COVID, what they are saying and the evidence is telling us is that it is short and self-limiting, and it will get better, but it can go up to it can affect a person for months. So in terms of attention and concentration first, I'll talk about the different aspects it affects. So your attention, concentration, your memory, learning of information, and executive functioning. So there's different aspects in terms of memory functioning. So as I said, your memory can come back to normal, but it will take time. And there are things that you can do, so we can talk about that as well. But in terms of attention concentration, people find it difficult to concentrate. And even if they're in conversations or they're trying to do tasks, they cannot multitask as they could before, or they could not even finish a task. So if you're washing the dishes or you're talking to someone, you might find it difficult to even follow your train of thought. So it can affect your attention and concentration. So even reading a book, watching a television program, or being around family and friends, people might notice that this person, okay, there seems to be a decrease in their attention and concentration. The second aspect is a memory. So learning new information or remembering things of day to day, people might find it a bit of a struggle, but there's things that you can do to help yourself. So we can talk about that. And then the third thing is executive functioning. So in terms of planning, organization, and preparing day-to-day activities, people can find difficult. Whereas before they were able to plan and organize their day, now because of the effects of the brain fog, they might find it difficult. So before talking about how we can help ourselves, I want to also touch upon the reasons why this can happen.
Just to go back in terms of what you're talking about, in terms of impact on individuals' concentration,
yes,
and so forth. It can become quite overwhelming for individuals to have to cope with this, and some may feel that I don't need to go to a doctor. They might try to cope with it themselves, and cope with it themselves can in fact make them more isolating, can't it?
Yes, I think it's important to recognize and accept so the acceptance and recognizing if there's an issue is important. As we discuss your recovery from COVID, there's enough information and signs, telltale signs. If you have any of the signs and symptoms that I've mentioned earlier and you're concerned, do consult your GP or healthcare professional. But things you can do, Valma, if we can just talk about that, and then I'll talk a bit about why it is that COVID actually causes these things. But let's touch on about how people can help themselves. So the first thing is recognizing and accepting, getting help, attention and concentration. We can try and think about limiting our task and our concentration to one sort of task at a time. So try not to multitask. Try and complete, even if instead of doing 10 things in the day that you need to complete, try and cut it down and have breaks throughout the day so that you can concentrate and be able to finish your task and be able to focus without any distractions. And if you need support, as you said, if you're feeling overwhelmed, which can be the case, instead of suffering in silence, tell someone close to you and say, I need to finish this piece of work. I'm finding it difficult. I need a bit of help and support. I need to check in with someone just to make sure that I'm able to finish my task. Or if you can't finish your task, if you're working or even with children, I think find out whether you can get an extension of deadlines, work deadlines, or whatever deadlines, yourself deadlines that you've set for yourself, or even at school if kids are having difficulty concentrating. The second thing is in terms of your memory, try and put reminders. So, have a diary or on your phone. Everyone's today has a phone, so try and put some reminders on your calendar, on the fridge, or reminders somewhere where you look all the time. And even in your bedroom, have something that reminds you, okay, today I need to do this, so you don't forget important tasks and important things that you need to remember, or appointments. So put it on a calendar, set your reminders, set an alarm for your reminders. So even things like taking medication, people find it difficult to remember. So I think getting a Dorset box, or even setting these reminders on your phone, it's so useful. So I would say start using your phone to the best of your ability, and use it to your advantage as well. And even if you've got a family member that's struggling, you can advise them and assist them. It's not difficult to do. So I think,
Seshni, what about mood? Because that's the most important thing. Because if you're going through this brain fog, you're losing your confidence, you're losing your self-esteem, you think something's going major wrong, and you start getting more uncomfortable or suffering from anxiety because of these symptoms. So we've talked about individuals being able to, go to their GP, identifying somebody they can talk to. But what about resting the brain, taking time? And if you've got a busy life, and it's very difficult to take time, but isn't this the time, the most significant time when somebody needs to take time to give their brain a rest?
Yes, so in terms of long COVID and brain fog, you do need to ensure that you have plenty of sleep. So I think sleep is one thing. If it's a take-home message, is don't compromise on your sleep, and especially because with COVID, as we said, people get depressed, they have more anxiety symptoms, and they also get the memory and the brain fog. So having enough sleep will also improve your memory and concentration, because you're ensuring that you are getting a rest. So I think what you alluded to was really good, Velma, because one of the things that they do advise is that someone needs to take some rest out. Don't overwork yourself. And also, because of the fatigue and exhaustion, I think what we need to remember is pre-COVID, or your pre-morbid self, pre-COVID, obviously when you get COVID and post-COVID, you won't be 100% the same. So you need to be kind to yourself, Alma, and people need to take that break, take that rest. So whether it's doing maybe 70% of the work that you would, 50 to 70 that you would usually do in a week, as opposed to 100%. And, just take baby steps. I think, we need to realize when we self-healing, and when we're going through this recovery period, it's important to take things one step at a time, instead of trying to do too many things and then overwhelming ourselves, because then we're going to end up with the consequences like extreme brain fog, cognitive decline, anxiety and depression. And it can become more serious, where people can end up being so depressed that they end up not eating, not sleeping, because insomnia is also one of it could be extreme exhaustion or insomnia in terms of long COVID, and and then can impact on the anxiety levels as well, so that they cannot function day to day. So I think really, giving yourself time, self-care, having a holistic approach. If you need treatment, go and see your doctor, your or a healthcare professional, or mental health professional, or someone that deals with COVID or post-COVID complication. As we said, Your Recovery is a really good, Your COVID Recovery is a good website with lots of resources. So I think it's important to get help.
Because obviously children may not say anything children may not even recognise that they are not feeling well in terms of their memory. But could it affect children? Because obviously if they're going to school, and this can impact on their education. Do you know if there's any research on this at all?
Yes, well, definitely. We know that long COVID is a significant complication of COVID, and symptoms can continue after 12 weeks. And the symptoms that we experience with adults and children can vary, but we do see symptoms in children as well. So children are also presenting with attention and concentration difficulty, extreme exhaustion and fatigue, and also difficulty with mood, anxiety, and other features of long COVID, sleep disturbances as well. So what we see in adults, we see in children as well. So all the advice that I gave about, focusing, try and do one task at a time, avoid distractions, and also try and improve your memory with reminders and timetables or a calendar, and also getting enough sleep is important, and then taking care of your physical health and mental health. So all these are really important, and I just want to touch on the holistic approach because we never spoke about the depression and anxiety in detail. And I think if someone is experiencing it, if it gets to the stage that you've got long COVID, and then you're experiencing anxiety and depression, as you said, instead of suffering in silence and alone and feeling overwhelmed, get help. And if you know someone else that's displaying these symptoms, try and get them the help. So speaking to, again, to your GP, healthcare professional, getting some support in terms of your memory and cognitive function. And also there are rehabilitation services. So the holistic approach we talk about, Velma, in psychiatry, as you know, is looking at medication, psychological therapies, and social support. So I think we need to tackle each one. If you need medication, an antidepressant, or you need something for your mood or anxiety, speak to someone, and speak to and get something prescribed if you feel that it's going on for longer than 2 weeks, your symptoms of depression or anxiety. And then the second thing is obviously, in terms of psychological support, we do have counseling services. There are services of rehabilitation. There's also services in terms of improving your memory, and also looking at cognitive behavioral therapy and any other therapies that we offer, that is offered for anxiety. So there are.
Yeah. The other thing also, because so many people lost relatives, some individuals might still be grieving and going through bereavement, and some might be even going through that in silence. So those individuals need to ensure that they do get help.
Yes, I think bereavement, I mean,
preventing getting worse, the depression or the isolation, and also self-neglect. Some individuals may even self-neglect themselves, not eating properly, not engaging in exercise or activities or social engagement, and be completely isolated, particularly those who live alone, particularly the elderly or, the disabled.
Yes, exactly. You spoke about bereavement post-COVID. Lots of people have had to deal with bereavement, or not even just because of COVID, but lots of other things people have maybe died from during this pandemic that we've had. And it's been more difficult because it hasn't been the normal way in which people would grieve. Sometimes even if their relative died of COVID, the normal burial process was not followed. It was different, where some people were not even able to see their loved ones being buried and perform the ritual. So it's been very different. And I think in terms of bereavement, as you said, depression, the Kubler-Ross stages of denial, anger, bargaining, depression, and acceptance. People go through all those stages of grief, and if they get stuck on any of those stages, especially depression, the bereavement can be prolonged or pathological. So it's definitely important people can seek help from a psychiatrist or mental health professional, psychologist, and also the healthcare professionals. And also CRUS is a charity organization, CRUS, that also helps people overcoming bereavement. But I think the social support, as you said, I think that's really, really key, Valma, even for most of us that have gone through similar things that we've spoken about today. Social support, I cannot emphasize how important it is in terms of getting help, having people to talk to. Don't isolate yourself, especially the young children. We need to be able to get them to talk about how they're feeling. and other people with mental health difficulties. We need to make it decrease the stigma and make it that it's okay not to be okay, and talk about how you're feeling and get help and ask for help. And especially also elderly people that are isolated. Today we're so lucky with technology that there's so many groups, online groups or WhatsApp or other support charity organizations like Young Minds or Mind is also, these are all organizations that help. And there's lots of organizations where you can contact them and you can get some support. So I think it's important that people get that support. And again, as you said, taking care of yourself. So make sure that you are sleeping, you're drinking enough water, you're hydrating yourself, you're taking time to exercise, or just movement is really important. Any form of exercise, if it's just even putting the music on and dancing, going for walks. If you've got a pet, take your pet out for walks, take walks in the garden. Just take regular breaks and, ensure that you're breathing and you taking a rest, you're pausing in your day and you're just recharging and rejuvenating yourself. I think it's really important. So that as well as eating healthy, as well as exercise and things.
Yeah, I was just going to mention that exercise, just going out, getting some
Yes.
fresh air, but also the fundamental thing is self-care,
Yes.
taking care of yourself. Your body is your temple.
I was going to say that.
Yes.
I was going to say that your body is your temple,
Sorry,
as you say. I was going to say that as well. I know your show is your body, my body is my temple. So your body is your temple. And it's so important that people need to be kind and take care of yourself. It's no use that if you are not well, you are trying to help others. So you need to be well and 100% before you can actually help other people. And I think people need to take care of themselves. And simple things like, mindfulness, meditation, or just taking breaks in the day and, having a chat with someone, listening to someone else, or helping other people, that can also improve improve the way you are feeling, because they say being of service to others, can help you. And but you need to be well also to be able to do it.
Also, what doesn't help, the financial situation individuals are going to be in at the moment.
Yes.
So, this mental health and the anxiety and all these frustrations now increase in heating bills. That's going to cause people to worry. It's just going on, and we do have to find a way, problem solve a way of how we're going to manage all these things that's been thrown at us.
Exactly. I spoke about this on Maritime Radio, actually, and it was one of the questions about how families are actually struggling. Even families that have children going to school are struggling to provide. And it's a question of whether do they just provide heating or do they buy food. And I think Rishi Sunak has provided, some benefits for people. But I think people are still not obviously satisfied that that's going to be enough. And I think it's a real worry. So what I can advise is, when there's fear around finances, try and get help. So face that fear, accept it, and try and get help. So whether it's contacting the Citizen Advice Bureau, to get some help. There's lots of food banks, Valma. So people that are struggling, there's enough food banks.
Managing anxiety, isn't it? And not letting it get out of control, so it doesn't end up with depression and other psychological problems. So
exactly,
it's also about people problem solving. And one of the important things is reaching out. There is somebody out there that can help you, whether it's an organisation, whether it's a friend. So I'd like to thank you so much, Seshni.
Oh, thank you for having me. And I just wanted to say,
thank you so much for taking the time to talk to us about what individuals can do to manage their health and well-being. So Thank you so much.
Yes.
And you take care of yourself.
Thank you for having me. And it was great talking about COVID, long COVID, brain fog, and how people can help themselves. So definitely, I'm really grateful to be able to have this opportunity. And my details are on Instagram, Facebook, Twitter, and on YouTube if anyone wants to find me. Thank you.
Yeah, right. Thank you so much. Take care now.
Thanks, Valma.
You're welcome. Bye-bye.
Bye.